What if I told you the most dreaded sound in all of dentistry, that high-pitched whine of the drill, could become a thing of the past for millions of children? No needles, no sedation, no surgery, just a few drops of liquid painted onto a tooth in seconds. Sounds too good to be true, right? Well, a landmark clinical trial just proved that it works, and the implications could change how we treat the most common chronic disease in children worldwide. Welcome to TrendForge. Today, we are breaking down a breakthrough dental study that could spare countless kids from pain, fear, and thousands of dollars in dental bills. Let us get into it. Tooth decay is not just a minor inconvenience. It is the most common chronic disease of childhood, affecting more than 40% of children in the United States alone. Let that sink in. More than 4 in 10 kids are walking around with cavities right now. And the consequences go far beyond a little discomfort. Untreated cavities can cause severe pain, serious infections, difficulty eating and sleeping, missed school days, and repeated medical appointments. Every single year, thousands of young children end up in emergency departments because of dental problems. And here's the worst part. Hospital doctors usually cannot fix the underlying dental issue, so some kids keep suffering from pain and infection while waiting for a referral to a dentist. For many children, the only solution has been surgery under general anesthesia. Think about that for a moment. We are putting young children, sometimes as young as 1 or 2 years old, under full anesthesia with all the risks that entails because of tooth decay. It is a staggering situation. Now meet silver diamine fluoride, or SDF for short. It is a liquid that dentists apply directly to a cavity using a tiny sponge-tipped applicator. The process takes only a few seconds per tooth. No drilling, no injections, no sedation. The liquid is simply painted onto the decayed area. Here's what is remarkable. SDF has been used successfully in many countries for decades. In the United States, dentists have been using it off-label since 2014, when it was approved by the FDA as a medical device for reducing tooth sensitivity. But until now, there had never been a large, rigorous clinical trial conducted in the United States to demonstrate its safety and effectiveness as a cavity treatment. That evidence is exactly what the FDA would need to approve SDF as a drug for treating tooth decay. Enter the University of Michigan. A team led by Dr. Margarita Fontana, professor of dentistry at the University of Michigan School of Dentistry, just completed a massive Phase 3 clinical trial. The study was published in JAMA Pediatrics, one of the most respected medical journals in the world. The trial enrolled 830 children younger than 6 years old. Participants were recruited through dental offices, pediatric medical practices, and Head Start and Early Head Start programs across 3 states: Michigan, New York, and Iowa. The research began in 2018 and continued even through the disruptions of the COVID-19 pandemic. It was funded by the National Institute of Dental and Craniofacial Research, part of the National Institutes of Health, which provided more than $12 million to support the study. The results were striking. 38% SDF stopped tooth decay in more than half of the affected baby teeth when the treatment was applied every 6 months. That's right. More than half of cavities were simply arrested, stopped, frozen in their tracks, no drilling required. Dr. Fontana put it plainly, this is a very effective and safe treatment, even in children as young as 1. Unlike conventional treatment, which removes part of the tooth before placing a filling, SDF does not require any removal of tooth material at all. The liquid is simply painted onto the cavity. The silver in the compound acts as an antimicrobial agent, killing the bacteria that cause decay. The fluoride helps remineralize and